employer mandate's never going to go into effect, I believe him. I mean, I don't know how it works. The minute you bring that employer mandate into effect, what is already a sinking ship goes right to the bottom of the ocean. So that's not going to last. And I would also argue that, the Clintons are very strategic.
Mm-hmm.
They don't. Almost nothing they do is not without intention.
Or thought out down the road.
Thought out. So, when it was leaked out that Hillary Clinton had opposition to the individual mandate, I think that was a strategic move.
Okay.
Because what I do think is going to happen is if we have anything to say about it, let's just say we win back to Congress, is that what you're going to see removed is these mandates. If a product is that good, I mean, people will want to buy it.
Okay.
If you can't mandate the people to buy it.
If you eliminate the mandates, Chris, does that mean that, what are we back to then, a Medicare, Medicaid type system?
Well, here's what I think will happen, is we will embrace, which we haven't done to date, we'll lift the exemption from the Sherman antitrust for insurance companies. See, right now, the only reason why you can't get substantive options across state lines is because there's actually a law that gives an exemption to insurance companies. And I think that will be taken off the books. And the way that this will, because if you look at our current array, it's a mess. I mean, just the rollout of this law, and it's just riddled holes in so many different directions. Now, I want to be clear here. I've always said this, and I believe it still. I've always said that this law would help some people, it would hurt more people than it helps, and we could have helped people without hurting people. Mm-hmm. That's what I felt back when I first read this piece in 2010, and I still feel that today. So aspects of the law are going to stay, some aspects of the law.
Right.
And we're talking about the pre-existing conditions, and we're talking about high-risk pools that allow for people to get access. Now, we may tweak how that's done to give more market forces into it. But the idea that individuals with pre-existing conditions could get access to health care insurance, that's going to stay. The donut hole closing, that will stay. The children, the choice of parents to keep their kids on plans till they're 26. Well, heck, it's 29 here in New York State. Right. I mean, that's going to stay.
Right.
So, and the idea that insurance companies can drop coverage once you get sick. I don't know how that can be so if you call it insurance. Those parts will stay, but I think the employer mandate and the individual mandate, I don't think that they survive. And the only way, because then you raise the question where you were going, Paul, is if they don't survive, then what's the
what's left?
What's the framework?
Right.
Well, the framework is true options. I mean, the issue is this: we need to be true to the goals of healthcare reform. The president's goals, which we're never going to live up to with the law that's currently on the books, is to drive down healthcare costs while expanding access to quality care. Mm-hmm. And that's where we should focus on those goals that we agree upon. And so one way to do that is to give us options across state lines. Another key thing that needs to be implemented is medical liability reform.
Well, that's a problem with state lines, though, isn't it? Medical liability. I mean, look at Indiana, where you got a ceiling out there of $50,000 on claims, and back here, I mean, you'll never see that happen in New York.
Well,
you'd have to get a
what we did
law
in the House, we actually passed a bill.
The legal lobby's too strong.
Well, we passed a bill in the House, but it went nowhere in the Senate. Right. And by the way, it did have bipartisan support.
It did, okay.
35 Democrats voting with us. I wouldn't say it's overwhelmingly bipartisan, but there definitely was more than just a handful of Democrats that voted for it. But interestingly enough, we used the California state model for medical liability reform.
Right.
Why do I say interesting enough? Because that's a purple state.
Sure.
But it's been working for them.
Okay.
What they did is they capped non-economic damages, the punitive damages at $250,000. Mm-hmm. And if you can prove economic damages, that's unlimited.
Yep,
and it should be, right?
I got that. Let me hold you there. We got news coming up at the bottom of the hour. I'll get some calls in from Chris afterwards. You mentioned Mrs. Clinton before I go to news here. When she parachuted into New York and became a senator, I was not a fan. I was against that from day one. I never liked that. How do you feel about people that parachute into a given area and decide to run for political office?
No, I mean, obviously, I don't like that. I think I'm just like an average person, that the idea of a republic and representative form of government is that a citizen would come forward for a period of time, not forever. I don't think that we were never meant to have a political class. And as you know, Paul, I've self-imposed term limits for myself. Even as I advance, I've said the most I'll serve is 8 years.
Right.
And even though I co-sponsored legislation to enact for everyone term limits. I don't wait for that legislation. I self-impose that term limits, and here's why. Because I think we were always meant to have representation from our communities.
People that have lived there, right?
From our communities.
That understand the neighborhoods.
That grew up there, that
Right.
understood, the issues, and then to go to Congress or to any other, like Albany, and to represent, and then to come back to the community.
Very good. Let me hold you there. Congressman Gibson Chair. I'll take some calls for Chris. I got a lot more to cover with him. 476-1300. We'll come back with Congressman Chris Gibson at the train station next on Talk 1300.
WGDJ, Rensselaer.